welcome to my channel. Today we're going to talk a little bit about B12 deficiency. If you're new here, my name's Amy, welcome. Normally I do videos on sort of lifestyle, home vlogs, hopefully at some point travel again. So if that sounds like something that you might enjoy, then please subscribe and you'll be able to catch up with more. But anyway, as I say, today is going to be about B12 deficiency, and specifically my B12 deficiency. Now, I am not a health professional, and I would urge you, if you feel any of these symptoms, not feeling well at all, go and talk to your doctor. B12 deficiency has lots of different symptoms, and the symptoms can be because of lots of different things, not necessarily B12 deficiency. So I am going to be talking about my symptoms, my diagnosis and my treatment in this video. Any sort of facts and things that I'm going to tell you I will have taken from the NHS website, because obviously that is a proper source. I'll leave it linked below if you want to go on the NHS website, but as I say, the internet is not your friend. Go to your doctor. Okay, good. We've got past that warning. So the first thing that we need to talk about is, what is B12? What is vitamin B12? Why do we need it? Where do we find it? So I'm going to read from my phone now because I want to get this right. Okay. So vitamin B12 is an important vitamin. It plays an essential role in the production of your red blood cells and DNA, as well as the proper functioning of your nervous system. Vitamin B12 is naturally found in animal foods, including meats, fish, poultry, eggs, and dairy. However, it can also be found in products fortified with B12, such as varieties of bread and plant-based milk. So our body doesn't make B12, we get B12 from our diet. That's quite essential. Vitamin B12 plays an essential role in the production of the DNA needed to make red blood cells. Without it, the instructions for building the cells are incomplete and the cells are unable to divide. This means that the red blood cells produced are very large and fragile. When the red blood cells are too large to pass out of your bone marrow and into circulation, you don't have as many red blood cells circulating in your body, which means that you don't get as much oxygen throughout your body because your red blood cells carry the oxygen around. And B12 also plays an important role in the production of myelin, which insulates your nerves and is critical for your nervous system function. So every part of our body relies on us having B12. Our body needs oxygen to survive. So next we're going to talk about the symptoms of B12 deficiency. Now this is a type of anemia also, so you'll have some sort of general symptoms, or you may have some general symptoms which are associated with having anemia. So from the NHS website, general symptoms of anemia may include extreme tiredness and fatigue, lack of energy, breathlessness, feeling faint, headaches, pale skin, noticeable heartbeats, palpitations, hearing sounds coming from the inside of the body rather than from the outside, tinnitus, loss of appetite and weight loss. So they're the general symptoms of anemia. Symptoms of vitamin B12 deficiency. In addition to those symptoms, you may also have a pale yellow tinge to your skin, a sore and red tongue, mouth ulcers, pins and needles, changes in the way that you walk and move around, disturbed vision, irritability, depression, changes in the way you think, feel and behave, a decline in your mental abilities such as memory, understanding and judgment. As you can see, general symptoms of a B12 deficiency are wide-ranging. They can affect loads of different parts of your body. So when you go to your doctor with your list of symptoms, these symptoms can be caused by a number of things. So diagnosis isn't always straightforward. Personally, from that list, the symptoms that I had, and maybe a few additional symptoms as well. So if we go through extreme tiredness. Now, yes, I did have extreme tiredness. Fatigue. I can't even explain to you how lethargic and fatigued I was. It wasn't that I was, yawning, a little bit tired, needed to go to bed a little bit early. I, at times, could not physically move my body. I would go to work, I would come home, I'd make a cup of tea and I'd put it on the side to sit in my chair. I did not have the energy to pick up my tea, to drink my tea. That is how fatigued I was. I would rest my head on the back of the sofa or the chair because I couldn't hold my head up. I struggled to have a conversation with my family because it was too much effort. I just couldn't do it. Like, every fibre of my body was exhausted. And unless you have felt that, it's really difficult to explain and to understand, I think. That is one symptom that was incredibly difficult. I had no energy or will to do anything. It was just very hard, and something that I'd never really experienced that level before. So that is definitely something that I felt a lot. Breathlessness. Yes, I had that. Before I started to feel like this, I was running 3 times a week. I was doing a yoga class once a week. I was also doing yoga at home. So I was pretty active. I was pretty fit. I couldn't walk up a flight of stairs without being completely out of breath. I couldn't have a conversation without being out of breath. Kept coughing because I was trying to get more oxygen into me. I mean, I'm out of breath now, but that's because I'm talking. But I was severely I was very out of breath anyway. Feeling faint. I didn't really feel faint, I wouldn't say. Headaches. Yes, I had a constant headache. I had a constant pain in my head that felt like my head was in a vice. I just couldn't. It wasn't sharp, it was just always constantly there. I just couldn't get rid of it. Pale skin. I mean, I've had pale skin for my whole life, so. Noticeable heartbeats and palpitations. Yeah, I definitely had heart palpitations. Hearing sounds coming from the inside of your body rather than outside source. Tinnitus. Yeah, I had tinnitus. And with that, I also get dizzy, so I get vertigo. Like, everything spins. Loss of appetite and weight loss. I wouldn't say I had loss of appetite. I would say I had loss of being able to feed myself because I just didn't have the energy to do that. A pale yellow tinge to your skin. I didn't really have that. A sore red tongue. Yes, my tongue was quite swollen and sore. Mouth ulcers. No. Pins and needles. Yes. So in my arms, and I still get it to a certain degree now, occasionally. I had pins and needles in my arms, and also numbness, especially in like the upper half of my arms. Changes in the way you walk and you move around. When I had vertigo, obviously everything's spinning, so you can't move around as much. Disturbed vision, not so much. Irritability, no. I wouldn't say I was irritable because I didn't have the energy to be irritable. Like, that would be too much. Depression. I was very down and I was very anxious. My anxiety was very bad. I've already said I didn't have the energy to do anything. I didn't have any interest in anything, which could be depression, could be lack of energy and lethargy. So kind of goes hand in hand, but my anxiety was definitely bad at this time. Changes in the way you think, feel and behave, and a decline in your mental abilities such as memory, understanding and judgment. Yeah, this was one of the hardest things about it. I had constant brain fog. I've always been quite switched on. I've always relied a lot on my memory and my quick thinking to do anything, especially with work. I don't really write things down because I remember them, like, it's fine. I felt like I had lost my mind. My brain just didn't work in the way that it has always worked before, which was so difficult. Like, it just, the one thing that you rely on just wasn't there. Everything, every thought, every decision, anything I did, it was like wading through treacle in my brain. Everything took 5 times longer than it does normally to do. I couldn't remember things. That was just such a weird feeling, not feeling like yourself. Yeah, so they're the main kind of symptoms.
There are a couple of other symptoms that I had which are not mentioned on the NHS website. The first being hair loss. So I was losing quite a lot of hair. Every time I touched it, every time I brushed it, had a shower, there would be a handful of hair. It was just falling out constantly. It didn't fall out in patches, it fell out all over, but yeah, I had quite a lot of hair loss. And the other symptom would be body pain. Like my whole body hurt. It was just it's like muscle pain, I guess. It's just very sensitive. And there was just sort of a constant ache that I had. So those are 2 things that are also not mentioned on here, but that I experienced.
Other things that I had night sweats. So I had really bad night sweats. I came up with a rash on my hand, and although that wasn't directly linked to B12 deficiency, that was just how run down I was by the time I got to the doctor. So I was feeling all of these things, and it's not that you wake up one day and think, this is how I feel. It's such a gradual onset that you don't really notice until you feel bad, like really bad. So we've talked about what B12 is, what vitamin B12 is, what vitamin B12 deficiency symptoms look like. So now we're going to talk a tiny bit about causes. I mean, obviously this is something that is individual. When you do go to the doctor and get diagnosed, they will explore this with you. But there are several causes. So something called pernicious anemia, which is an autoimmune disease, and it is the most common cause of vitamin B12 deficiency in the UK. So it's an autoimmune condition that affects your stomach. Normally, vitamin B12 is combined with a protein called the intrinsic factor in your stomach. Then the mix of the B12 and the intrinsic factor is absorbed into the body. Pernicious anemia causes your immune system to attack the cells in your stomach that produce the intrinsic factor, which means your body is unable to absorb the vitamin. This is more common in women around 60 years of age and people with a family history of the condition, and those with other autoimmune conditions. So when you find out you have vitamin B12 deficiency, they will test your intrinsic factor to see if you have pernicious anemia. They tested mine. I do not have pernicious anemia. So another thing that can cause it is diet. So we know that vitamin B12 is you absorb vitamin B12 through your diet, and it's found in meat, fish, dairy products. Your normal everyday diet produces enough B12 for you. Obviously, for people who are vegan, particularly, they do not consume any of these products to get B12. So for someone that's on a vegan diet, it's important that they get B12 from other sources. And then another cause can be sort of conditions that affect your body. So other conditions that you may have, you know, such as Crohn's disease, something like that, that can affect your ability to absorb B12. And certain medicines that you're on can also affect your ability to absorb B12. For me, I just don't absorb B12 anymore. There isn't none of those other things contribute to that. It's common that as you get older, like into your 80s, you lose your ability to absorb it. So B12 deficiency is fairly common in the elderly. I'm nowhere near 80, I hope that's obvious. So yeah, for me, I'm just one of those people that doesn't absorb it very much. There is no rhyme or reason to it. My body just doesn't work that way. The next stage then is diagnosis. You're feeling horrible, you go to the doctors. As I have explained, that is incredibly important. You talk about it and they will diagnose B12 deficiency through a blood test. So when I went to the doctors, I had written out a long list of my symptoms. Also, at this point, I feel like it's important to note that I'm talking about my experience with the NHS. So I don't know how these things may differ in different countries, but this is my experience with the NHS. So I went in, spoke to the doctor, and she said, yeah, we need to do some blood tests. These symptoms could be from a number of things. So they took my blood. They then rang me in a couple of days, I think, once they tested it, and said that I had a severe vitamin B12 deficiency, and also my folate levels were low, which is B9, which sometimes does go hand in hand. And so I needed to start treatment for B12. The folate deficiency I could deal with by taking folate supplements, but the B12 I needed to then go in and have some B12 injections. Initially, when they treat B12, you go in for 6 injections over 2 weeks. So basically almost every other day you're going in for an injection to really boost you, to get those levels back up again. So I had those, and then you wait 3 months, 12 weeks, and they do another blood test and see how your levels are. So that's what happened to me. I went in for my first course over those 2 weeks, waited for 3 months, and then had a blood test. Now, I would say I've started to feel better after a couple of injections. And by better, I don't mean back to how I was before. I mean slightly less terrible than I was feeling. I think there's a big difference. This was the September, and in the October I managed to go to Orlando with my family and do 11 days doing theme parks, etc. Now, in the September, I was terrified that I was going to go on this holiday and ruin it for everybody because I wouldn't be able to do any. So yes, I was feeling better. On that holiday, I still had to take regular breaks. I still had to have a nap every now and again. I didn't have the energy that I had, but I was managing to do it. And in the days that we were in a theme park, I did 20,000 steps, which a month before that would have been impossible. I don't know how I would have done it. So I did start to feel better, and some of my symptoms had started to sort of wane. But what I would say is your symptoms all come on gradually, and different symptoms develop at different times. Your symptoms all go gradually, and different symptoms go at different times. It's not a magic fix. It doesn't instantly make you feel back to normal. The thing I still struggled with was my memory and my brain and my thinking. That took a really long time to be back completely, I would say. My breathlessness still, my cough, I was still tired. So yeah, but I was feeling better. So after those 12 weeks, I had another blood test and found out that I did have B12 deficiency. It wasn't just a blip, like those injections didn't stabilise me and I was back to normal. That's when they tested my intrinsic factor. It wasn't down to pernicious anemia. From then, I was prescribed injection and a B12 injection every 12 weeks. After probably maybe 6 months, I can't quite remember now, this was 2 years ago, I was noticing that I would be fine, and then I would get to 10 weeks and it would be like I'd crash. Like those last 2 weeks, I was just hanging on waiting for my injection. So I spoke to the doctor and they said, yeah, that's not normal. You should be on a constant level. So I now have my injections every 10 weeks rather than every 12. When you're being treated with the NHS, I believe, like the standard is 12 weeks, but you can go down to every 8 weeks if necessary. But I'm on every 10 weeks. I'm now 2 and a bit years on, actually feeling like myself again. I would say it took at least a year for me to feel completely like me again. Yes, you do feel much better. You'll never feel as ill as you did, but you don't feel 100% back to normal immediately. It's a slow and gradual build up to build those B12 reserves back up. So that's pretty much it, and pretty much all I wanted to talk about. Just I wanted to explain how I felt, explain how easy the treatment is once you know what the problem is. So we're going to leave it there. Normally I film lifestyle content, home vlogs, eventually travel, so if that is something that you would be interested in, then please subscribe to my channel. If you enjoyed this video, please like it. If you want to chat about anything, please pop a comment below. But I hope you have found this useful if you have got a vitamin B12 deficiency. And yeah, that's pretty much it. So thanks so much for watching, and I will see you in the next one.